Good afternoon, good morning for some of you, wherever it may be. My name is Jason Merrick, and I'm the President and CEO of LearnCdo. I'm also a licensed nurse and paramedic and new father. When my daughter was born, she had special needs. Some of that care took over 2.5 months to get to, even with health insurance. There were some ordinary problems, such as breastfeeding, and also we had problems with immediate access to care. No parent should have to go through this. The problem, you're a parent, it's the middle of the night, your child wakes up screaming. You just can't quite put your finger on it. You can take them to an ER or urgent care. What other options are out there? The problem of access, and we know the problem is large. Before the pandemic in the US, the Children's Health Fund estimated over 20 million children faced significant barriers to essential health services. During the height of the pandemic last year, over 8% of physician offices closed, or 16,000 offices, most of them independent. And at the end of 2020, while with ambulatory care, only 5 to 6% of adult visits were down. With pediatrics aged 3 to 17, over 24% of expected visits was less than that. It's a problem. The solution. Now imagine an advanced healthcare advice line that's available to parents 24/7, whenever they need it, to be able to advise them and improve parental decision-making. That is care. We do so through a native mobile, HIPAA-compliant, proprietary video call app. We have experiences and features that improve the connection between the user and the expert, such as call transcription to improve the continuum of care, emergency alert button, and other spoken languages for people who don't speak English as a primary language. We have at launch over eight categories of experts. That include generalists such as nurse practitioner and RNs, but specialists such as dietitians, midwives, lactation consultants, physical therapists, and sleep consultants. Many of these are very difficult for parents to get access to with ordinary insurance.
10 seconds.
The traction, when we opened up our platform in the fall of last year, we had over 16,000 experts in the US apply to our platform, and it's only been growing since. The team, as I mentioned, have experience in medical care, also experience in over 20 years of experience with startups, starting with global media ventures. Sam Johnson, our COO, he's helped grow tech companies from 1 country to 64 countries of note booking live. Mustafa Sayraki comes to us from Sony, Qualcomm, Ingram Micro, and Dr. Pravin Nini, who is a pediatric ophthalmology surgeon. Thank you very much.
Awesome. Thank you, Jason, very much for that. Great presentation. We'll go ahead and open it up for questions. And I just wanted to also remind the judges to please fill out the scorecards on this last one too quickly, so we can have a decision quick. I'll go ahead and open it up.
Hi, Jason. So this is for I guess you said that this is for people who have insurance. So what's the difference between this and just going to their pediatrician? Like pediatricians usually have, a 24-hour nurse line. So is this really for people who don't have insurance and don't have the ability to find a pediatrician?
Right. So a couple of things there. First, we're direct to consumer initially. So it's a direct to consumer pay-as-you-go model broken into 5-minute increments. So it's through the consumer base. Insurance may come on the line, so not immediately. We know that if you were to just contact a pediatric office, for example, I contact my pediatric office, almost all have a disclaimer, it could take up back to you. So this is available when you need it right now. So you don't have to wait that interim period wondering what to do, which eventually you start to worry, and you eventually go to the ER and urgent care, which is very expensive. So this is immediate access to these providers. And it's beyond pediatric office. You still then would have to get a referral to a physical therapist. We eliminate.
Oh, okay. So I understand. So this is okay. Sorry. So just wanted to get more specific. So these are for children that need kind of like the constant sort of care, not just your average child, right?
Well, it depends on the age. So if you're looking, and it's very broken down by age group. So we're focused on the beginning from the child from 0 to 6 months to infant, that first year of life, when parents are most likely to engage on this platform. So, and it could cover topics from anything from you're having trouble breastfeeding, your child's not crawling yet, they're not speaking right, a multitude of problems that you as a parent are looking for help or advice or service from. When normally you go to a pediatric provider, we're just more immediate, and we are part of that continuum of care. So if that parent wants to know what advice they were given and communicate with that primary care office, we can do so.
Okay, thanks.
Jason, I had a quick question as well, and it was about kind of the trust as well. Christine had mentioned, phoning my kid's primary care physician, etc. How do you kind of build the trust with the consumer in order for them to kind of want to access this type of health advice?
Right. So it all comes to the advice they're given, the experts themselves, and it generates reviews. So we are hiring or bringing on experts that we qualify ourselves, and then making sure that they give quality advice. So if that parent or that caregiver is getting quality advice, helping them assuage their problem or recommending a plan of action that they can take, which may include contacting the primary care provider, giving them confidence. So it's a matter of the advice they're given and the quality of the expert that we put onto our platform.
And right now, how are you sourcing experts? I'm sorry if you already repeated that.
Right. So we are we're doing it ourselves. We reached out to national recruiters, healthcare, and they don't necessarily have a model, especially when you get into specialists at scale. It's still focused mostly on physicians, nurse practitioners, the generalists. So it's limited in that sense. It's also very expensive. It's more for a full-time employment opportunity type of scenario. So we've developed a model ourselves. We use a multiple anywhere from Indeed, ZipRecruiter platforms to source the experts, and we reach out to them ourselves.
Great, thank you. Anybody else?
I just had a question on the business model in terms of who's wearing the cost for this. Is it mostly the parents, the direct consumer, or is it the insurance companies? I'm not quite sure on that. And if so, how does equity and access become how does that build into your model? Because are you just providing care to the people that can afford it?
So I can try to answer that question. I don't know if I understood all facets of it, but when the model is just it's direct to consumer, so the cost is borne by the user, the parent, or the caregiver. It's an affordable cost, broken into 5-minute increments. We know that the average doctor visit in the U.S., actually, whether it's telehealth or in person, it's very, very similar at about 15 minutes. But you take out a lot of the vital signs, the intake form, a lot of that stuff out of the picture. It's about 10 minutes face to face. So we expect our visit to be about 10 minutes. And if you average our costs, we're less than the cost of what a parent would pay for a healthcare copay, which is about $50. Our average cost is anywhere between $14 to $18.